End of 2024, I was diagnosed with adenoid cystic carcinoma. It was in my sinus, growing through the roof of my mouth up to my eye and back to my skull. It's a rare cancer. I think only 4 people out of 1,000,000 get that one. When I first found out about my cancer, there was huge uncertainty, a lot of anxiety, unsure what it's going to mean for me and my family. The tumour had eaten through my nerves and it was actually pressing into my face and just making me dizzy and faint. I was very unwell. I was sleeping most weekends and I had issues with my nose and a lot of pain as well. I met Carla first when I was leaving hospital. She helped discharge me from the hospital. She gave me instruction packs and medication and things to take home with me, like dressings.
I'm Carla. I'm a specialist nurse with the head and neck team at Chris O'Brien Lifehouse. My day typically starts off going to the ward and meeting all of the patients who are about to be discharged. And I go through with them their post-op instructions.
If I have pain, bleeding or swelling, so any symptoms that create uncertainty or bring anxiety or that they haven't prepared me for, I reach out to Carla for. One day my eye started swelling up and by the end of the day it had gone completely shut and I lost sight out of that eye. And Carla, I was able to message through photos and she gave me advice and then organised me to come into hospital for a checkup. I ended up being on IV antibiotics from that one.
I make a difference so much more when the patient is from regional or rural areas. Most of those patients don't have access to, or quick access, I should say. They don't have quick access to GPs. So sometimes they would have to wait weeks and weeks or even long wait in the hospital ED just to be seen. And with me, who's just a phone call away, they're able to get an answer relatively quick about what they're worried about.
Having Carla there to answer my questions and be there for me as a backup really took away my uncertainty and anxiety.
The difference between a specialist nurse and a registered nurse is that there is a higher expectation of the level of care that we can provide as specialist nurses. Our experience in the job had given us all of this insight and wisdom and clinical judgment that we're able to put into practice. Essentially, clinical nurse specialists are the bridge between the nurses on the floor, on the ward, and the medical team. Patients know that they can reach out to me and they get a response from someone who knows their situation.
If you're lucky enough to have a Carla in your life, then you're going to be set up for a lot more success following your surgery because you just won't have the same level of concern, worry and uncertainty to have someone there you can ask questions for or someone you know who's caring for you even when you've left the hospital.
The most rewarding thing about my role would definitely always be the patients. It's always how the patients feel, how we make them feel, how we make them feel supported, how they feel seen and heard. And really, it's the human connection that makes it feel so much more rewarding.